Hello ladies and welcome back to my channel. My name is Aisha, aka Nurse Aisha. I'm a registered nurse here to spread awareness on preventative health and lifestyle choices for women. This is my focus so you can lead a healthier and more informed life. Welcome to this episode. So I am here with a very important guest, so I'm a little bit nervous and taken back by her presence here on my channel. She's a psychologist, an amazing woman, and I'm going to introduce her with information that I have. So, today I have in the studio Hanna Wallenteen. Hanna is a psychologist, a lecturer, a public speaker. Her work has been featured on radio shows, television, podcasts, magazine, etc., where she talks about norms, racism, inclusion, and minority stress. Hanna works closely with schools, social services, occupational health care, and organizations to tackle these issues that I just mentioned. And she's here today to talk to us about mental health, therapy, and minority stress. Important topics for us, this community that I represent. So please welcome Hanna Wallenteen. Thank you for coming.
Thank you, and what an introduction. Thank you so much.
My heart is beating so fast.
Really?
Because I'm
Mine
nervous.
is.
I'm nervous to have you here because I've been listening and reading your work. I've listened to radio shows that you've been part of, talking about our community, people of color here in Sweden, telling my story a little bit.
Yeah.
Okay, so this is very, very sensitive for me. So thank you so much for coming.
Thank you for having me.
Let's not get too emotional. Let's get into the topic. We're going to talk about therapy,
Yes.
mental health,
Yes.
and minority stress that both of you and I have experienced. Yeah.
Certainly.
So let's start with the first question. Why is therapy so important for us as people of color, as minorities, and children of immigrants?
Yes, thank you. And I'm really happy that you're bringing this topic up because, as you know, from many of the countries that people come to from to Sweden, talking about mental health is not very common. It's sometimes regarded, and it used to be in Sweden as well. I mean, just go back 100 years in Sweden,
Yes.
nobody talked about mental health.
Yes.
So sometimes we get a little blinded by our present, and we forget that this has always been a sensitive topic to
Yes.
people. But fortunately, over the last, I would say, 70 years,
Yes.
there has been a lot of progress in research on mental health, and it has made it much easier for more people to start talking about mental health, psychological issues, because we also know that there are ways to treat this. So if we are unhappy, if we are depressed, if we're suffering from anxiety, which is very, very common in all cultures,
Yes.
then if we realize that there is actually help that we can get, then of course it's much easier to talk about. But if we don't know that, we might get it mixed up and think that mental health or ill health is something that only concerns people who are, like what we say, crazy, people who we can't understand why they are behaving the way they are. Interestingly enough, there is almost always a very reasonable way to understand why people are the way they are, even when they're seemingly crazy.
Okay.
And I think realizing that, and also realizing that this is something like suffering from bad mental health, is something that could happen to anyone.
Yes.
Yes.
So you having, should I say human experience, or just connecting with your therapist or psychotherapist?
Yes.
How important is that?
Well, actually, that I'm glad you brought that up, because actually studies have shown that the alliance that we're able to create, therapist and client or patient, is one of the main factors for how successful a therapy
Yes.
actually becomes. So, if we're looking for therapy, I would say in Sweden, it's good to look for someone who is licensed because
Yes.
that means you've gone through an education and then you've been licensed by the Swedish Socialstyrelsen, which means that if you are being mistreated or ill-treated, there is somewhere you can go and complain and actually stop this provider,
Yeah.
which you cannot do if you go see someone who is not licensed.
Okay.
Then you've just lost your money.
Okay.
So that's one thing. But then after that, I would say the most important thing that you can do is actually, if you have the opportunity, then go see the therapist for a first session and be prepared to use that first session both for your therapist to get an idea about what your problem is, but also for you to get a sense of how do I feel talking to this person?
Yes.
Do I feel comfortable? Do I feel like this is someone I trust, someone who I can really tell the truth? Because if I feel like I think I'm going to be judged by this person, how am I going to open up? And if I can't open up, how is this person going to help me?
Yes.
I mean, then it becomes
You're withholding information.
Yeah, then it becomes an impossible job for the therapist, and you will be just wasting your time and probably money too.
Because many of us in my friend circle, I recommend my therapist to all my friends.
Yes.
Only because I feel such a connection with her as a woman of color, as someone around my age, a bit younger perhaps, but also I feel like we connect, not only that she can help me with what I'm struggling with, but also just understanding me from a cultural perspective. So we have the culture as the base.
Common ground.
Yes, even though I'm very invaded or I'm very into the Swedish culture, I just feel like her as a black woman can understand the struggles that I go through. So I usually, but then that doesn't mean that my friends might connect with her.
Exactly. And it's very interesting when we're searching for a therapist, most of us look for different things. So someone might say, no, I don't want to see someone who's the same age as I want someone to be older and wiser, or I'd prefer someone who's younger. Someone would say, I could never, as a woman, I could never talk to a male therapist, whereas others feel like, no, I don't want to see a female therapist because that'll be uncomfortable. So we are all looking for different things.
Yeah.
But I think since we're unfortunately not yet very many therapists who are people of color in Sweden or black, and for that reason, I think it's a good thing if we feel like we're willing to try. We could also go see a therapist who's white, who's maybe like been a Swede for generations.
Yes.
But then if we feel like the color issue and the ethnic issue and the cultural issues are important to us, it's important that we tell our therapist that from the beginning.
Yeah.
Like, okay, so I'm coming here to see you, but for me, my cultural background or my ethnic or my color-wise background is important to me, and it's something that I want to be able to talk about here in therapy. What's your position on that? And that'll give us a pretty good idea. So hopefully, our therapist will answer, okay, yes, obviously, I don't have the same experiences as you do, but I am very open to this. I would love to help you and listen to you, and I'll do my best. And I would like it if you tell me if I'm saying something stupid or not that you're supposed to educate me, but just because I care about our relationship, and then I might have to go Google something.
Yeah. But I think, I don't think that anybody in position or in even me as a nurse, I learn from my patients continuously. And I think that is also something that me and my therapist share. We connect on an intellectual level.
Yes.
She can ask me questions and I can answer them from my experience as a nurse, and vice versa. She teaches me a lot. We're there for me to learn and to get to know myself. But we have an exchange of intellect that way. So that can also help.
Yes.
Maybe when you're looking.
And sometimes, I mean, sometimes when we're looking for a therapist, we think, okay, I need a therapist who can really understand what it feels like to be me. But of course, and I think it's the same for you as a nurse. If you have a patient who's suffering from cancer, but you have not had cancer yourself, you can still be of a lot of help. And this is the same thing. Even though I have never been schizophrenic, I can still be of help to a client with that kind of problem.
Yes.
So
because we cannot all have the same experience.
No, and I can't have all the experiences that my clients have had, then I wouldn't be sitting here.
No, of course. All right, so that was mental health and therapy.
And professions,
so as immigrants and refugees, we suffer a lot of hardships trying to get into this society, trying to fit into it. We come from our own societies, and then we come to this new country, and we are forced, or we have to, we're obligated to learn the norms and everything here. And while doing that, we face what you're very passionate about, minority stress. What is that?
Yeah, minority stress is it's actually, it comes from a model called the minority stress model that a researcher, Elon H. Mayer in the United States, he was looking at, actually he was looking at gay men.
Okay.
Yeah. And so this model has been used very much within the LGBT community to understand what happens when there's a stigma against our minority group within society. So if I live in a society where there are negative perceptions of my minority group, as in Sweden, where there are negative perceptions of immigrants from especially non-European countries, how does that affect our, like on an individual level, how does that affect our emotions? And what this researcher saw was that it can have a great impact. It doesn't have to have an impact on people, but it can. And so what it can be is that we worry about others perceiving us not as individuals, but as people of lower value than the people who belong to the norm or the majority. Yeah, we can be dehumanized or just belittled or made invisible.
Yeah.
So there can be different ways. And so when we worry about this, when we're feeling this kind of stress, it's a negative stress. And obviously, negative stress, we know already, it takes a toll on us. And the thing, I think it's what is very good about the minority stress concept is that it states that for us to call it minority stress, it has to be a stress that those who belong to the majority and the norm do not experience. It has to be a stress that goes above all the regular stress, like I have the deadline, I have to pick up my kids in time, and then this stress comes on top of that.
Okay.
And then the third thing is it's chronic. It's something that we live with throughout our lives. So I can experience this already in kindergarten. I can experience this when I'm old. I can experience it on the bus, in school, at work, when I see my doctor, when I'm trying to get to know my new neighbors, my new colleagues, when I'm dating, in all different kinds of life. Yeah.
And you feel inferior to
the
majority.
So we'll have different reactions.
Okay.
Yeah. So some of us will feel inferior. We can internalize. So I usually talk about like 3 ways of handling minority stress. So one is the internalizing, where we think, oh well, yes, of course. If we take the position as an immigrant, well, yes, they're probably right. We're not so good. We're not so capable. We don't look as good. So I internalize the negative expectations, the negative values, the negative stereotypes, and make them a part of my self-view, like and my self-image.
Yes.
And I say to myself, yeah, that's right. No, I'm not. That's why. And then what happens is if I do this and it's very negative, well, it's kind of obvious it will affect my self-esteem and my self-confidence. And the problem with that is I'm much more vulnerable to depression, to anxiety. If someone says, okay, you made a mistake here, I will think, yeah, but that's because I'm not so good because I am an immigrant, and so there's no use in me trying.
All right.
And then I won't try, and guess what? That becomes a self-fulfilling prophecy. Because if I don't even try,
Yeah.
how am I going to get better at anything? So it's really destructive, like when we internalize these negative ideas, because it will stop us from
Succeeding,
trying
yeah.
and thriving. Another thing is, for some people, this results in thinking, well, since we're so much worse, why even try? But it's so unfair, and we get very frustrated and angry.
Yeah.
And angry with everyone else who seems to be so privileged.
Yeah.
And this is all we see, and it just spirals us down.
Yes. Yeah.
So it becomes very destructive. What is interesting about this way of relating is that at the same time, it can help us avoid conflicts. Because if someone says, you're bad, and I say, yeah, I am, okay, there is no conflict there.
No, you're just accepting.
I'm just accepting.
Yeah.
Whereas if someone says, you're bad, no, I'm not, then we have a conflict. So this is why people would use this internalizing strategy. Okay. This is not going on consciously. This is very unconscious. Yeah, very, very. So that's one strategy.
Yeah.
The other strategy would be what I call assimilating, not integrating, where we take two different parts and put together and maybe it becomes like something even bigger and better. But where we try to adjust and be as much as possible as the norm and the majority.
Yeah.
Meanwhile, we're trying to hide, we're trying to make invisible, we're trying to take away everything that is different and might belong to our minority position.
Yeah.
So it's like pretending. I pretend that I'm just like everyone else, which is ridiculous. Like, if I'm going to pretend that I'm a tall white Swede, it's ridiculous.
It's the opposite.
It's the opposite. I'm not a tall white Swede.
Yeah.
But
with blue eyes and
blonde hair, and I go around like doing this, and everyone's like, "Why is she shaking her head?"
Yeah.
No, but really, what is interesting about this is, so take for instance, if I go to my workplace and I pretend that I do not have all the experiences I have from another country, or maybe several countries, all the knowledge I have of living with different cultures, all my languages, I just go to my work and I pretend as if I have nothing of that. So what is my employer actually getting access to? And or on the other hand, what if I go to work and I pretend that I have a summer cottage, I have a sailing boat, or
and people go to these extremes to pretend and
sure. And and for instance, if I love the food that we make from my home country, but I feel like I can't bring that in my lunchbox. So I bring something that I don't even like for lunch, because I get so tired of everyone saying, oh, is that something exotic? So all these adjustments.
Yeah.
And
to please others.
To please others.
Yeah.
And what is because everyone adjusts. But what is super important about this is, am I doing it consciously or subconsciously? Because if I'm not even aware that I'm doing this, I might lose myself. It's as if I lose parts of my identity. And what happens when I start dating, when I start getting into close relationships, if I'm always pretending to be something that I don't feel like, and that I'm not.
That's a problem already, even without the minority stress.
It is.
Trying to be yourself.
Yes. And this is just one more extra layer, and sometimes several more extra layers.
So,
and also that could also mean like constantly code switching between like who I am and act like at home, or in my community, in the Swedish society.
Living a lie,
or living like different people, and just never getting to be true to yourself. And how much access do I get to my own resources? How much of my own full potential am I actually living then?
Yeah. So internalizing, assimilating.
Exactly. And then we have the hypervigilance.
Okay.
Which is, I realize there are negative ideas about my minority group. and I try to avoid them at any cost. So I'm super aware, I'm hyper vigilant, and as soon as I notice something that seems like, is this going to be racist?
Okay.
Then I put my guard
your
up.
guard up.
Yeah.
Yeah.
And of course, if you're going to talk to me and I'm sitting like this, and I'm like constantly ready
To fight.
to fight, what kind of relationship are we gonna have here?
Yeah.
It's gonna be kind of problematic. And
Yes.
so what happens is I would probably be at risk of just punching just by reflex. And this is when people will say, when I will say, "Are you racist?" And people will say, "Oh, don't come dragging with the race card
the
once
race
again."
card. Yeah.
And they will say, "No, I was just asking if you would like to come over for dinner.
Yeah.
I thought you said something else,
Something else, yeah.
whatever." So that's one problem. What can happen is that I have my guard up and I say, "That sounded racist." And I meet someone who is calm and who says, "Oh, did it? I didn't know. What did I say? Can you please tell me?" And I will say, "You said this and this and this." And I've heard it many times before. And maybe I'll get the answer, "Oh, you're right. Oh my goodness, I didn't realize I was doing that. I'm so sorry. You're absolutely right. Yes, I was on the wrong track. I'm so sorry. I hope I didn't hurt you. Can I do anything to repair, to compensate?
Yeah.
I will go Google and make sure I don't use the wrong words, or that I understand exactly. I will read the book. I will listen to the podcast and
I'll
see
listen
the
to
movie."
Hanna.
Yeah. So but what could also happen, and this is the thing that I think many of us have experienced, is that we say, "Are you racist?" And they say, "No, we don't have racism here." And we're like, "Oh, but you said
Offended.
this, you
Yeah.
said that, I saw the signs, and you gave me that look, and then you actually didn't give me the same benefits as you gave someone else." And they say, "Oh, but that was not it," or "You shouldn't be so sensitive. I was just joking." So our experiences are denied, and even though there is actually something really racist going on, because we will have, like, when we're hyper vigilant, we learn to recognize things, and we probably study and we understand, maybe we understand a little bit more of structures than the ordinary normative people who have the privilege of not having to deal with it.
Which
And
one
so
is common?
we might point out something that is actually there, but the people around us don't recognize it.
Which one is most common?
Which strategy?
Yes.
I don't know. I think it also differs. For some of us, we use different strategies in different contexts. And in some contexts, where the issue of racism specifically, if that is not even an issue, then how can we point it out?
Yeah.
Maybe
I'm thinking,
maybe the only way for us to survive is assimilating.
Yeah. Because I'm thinking this different depending on where you're from,
Yes.
and how you came here and why you came here.
Exactly.
Because this everything you're describing, I've seen.
Yes.
One way or the other.
Yes.
With people in my family, my community, are just around me, and I think the African experience is different from people coming from Europe and people coming from
China.
Yeah.
Yes.
So
Definitely.
it all depends, and I think it's also seasonal, depending on because when I came here in the 90s,
Right.
there was a lot of people from different countries coming in because of war. We had the Somalian war, there was the Balkan war, but we were all treated different. And then all of the young boys and girls that grew up in the 90s, we all have then suffered some type of, because I believe this comes from some type of trauma, leaving your safety net and coming here and then trying to prove yourself, and then going through adolescence and trying to grow up and live a quote unquote normal life.
Well, I'm glad you mentioned the fact of trauma, because I believe people living in Sweden people who've grown up in Sweden but perhaps have immigrant parents, they also experience minority stress. But if we have trauma within our family or in our own personal history,
Yeah.
that's going to be one more layer of
Yeah.
that's going to be an extra burden.
Yeah.
So then we have two of them, and the same goes for if we have many minority identities. Like if we're both Muslim in Sweden, which is very Christian and non-religious.
Confused, yeah.
Yeah. If we belong to the LGBT community, if we have some kind of disease or are disabled in some way,
yeah.
so then we have even more layers.
More layers to it.
So, yeah. So we can
Okay.
suffer in many ways. And I
Yeah.
think if we have traumatic experiences, both in our family history and for ourselves, then sometimes that is also something that we need to treat. And what is important to understand here is that neither minority stress nor trauma is something that everyone who has been exposed to either racism or any kind of oppression or trauma need to suffer from.
Yeah.
Some of us go through trauma and we heal.
Yes.
And some of us experience racism or oppression, but we are not stressed out by this because some of us have other resources.
Strategies, yeah.
Yeah, and resources around us. We might have a great psychological disposition, but we might also have a community, a family.
Yeah.
There may have been people around us to help us process what we've been through.
A good foundation.
A good foundation.
And
there might be people in the majority group that have helped us. Like
yeah.
when we've come to someone and said, I was exposed to this kind of racism, and they've said, oh, that's totally unacceptable. Let me help you. Okay, then I learned that if something racist happens to me, there is help that I can get. So of course I'm not as stressed out.
Yeah. And if you can't handle it, you get a good therapist.
Can you get a good therapist and you get a community?
Yeah.
I think I cannot stress enough the community. So I would say therapy, that is something that is really great if we feel like my problems are getting too heavy or too complicated for me to keep coming to my friends with.
Yeah.
I feel like I'm just burdening them.
Yeah, going on and on about
Yeah,
the same problem.
I can't get out of it. I'm just, yeah. Or we feel like I can't even tell them. I can't even tell someone what's going on. So then it often feels like a good place to see a therapist because they also have their professional secrecy.
All right, so I think we already covered the other question, what are consequences of prolonged minority stress?
Yeah.
But if we take examples, for instance, there's been issues of people not being able to get jobs because they have their guard up and they expect to be mistreated and
perhaps they're not even applying for jobs that
Exactly.
they could apply for because they assume, well, I won't get it. They'll see my name, then they won't even want to see me.
Yeah.
Although, even though maybe that has happened 3 times, that doesn't mean it will happen the fourth time.
Yeah.
But I give up before I've even tried. So that can be one thing. And also, of course, if I come into my job interview saying, hi,
Yeah.
I'm going to have a pretty bad interview.
Yeah.
But there is also actually, if we get very worn out by this constant stress, we can also have somatic diseases such as heart diseases, metabolic diseases, diabetes.
Because I've had friends come to me and tell me, I'm highly educated, but I can't get that job because I feel oppressed.
Yes.
They won't take me in for an interview.
Right.
Is it like that in Sweden?
Yeah.
And I always think to myself, well, I'm not quite sure, but if that company won't hire you, can you go to the next company?
Yes.
But then it's very hard because you don't know that person's experience and why they're thinking this way. And then some people going to assimilation then try to
adjust
and get a better status in society, doing different things.
Yes.
Thinking that will help their situation, what they're
Yes.
feeling inside.
Yes.
But really you can't put a cover over it because it's going to come out eventually.
Yes. Yes. And I think that's the experience. So that's why I'm stressing having access to a community.
Mm.
If I have access, and when we meet in our communities of other people with similar experience, it's really important that within our community that we help each other by being there, being able to validate, okay, I hear, oh, I see, I've experienced something similar, or tell me more. I'm so sorry you had to experience that. So that's the validation. But from there, we want and sharing, and sometimes we can really laugh at things, which is lovely. But from there, we also want to ask ourselves, so what can we do to change?
Yes.
What can we do? Can I help you with your job applications? Would you like to practice with me what it's like to go to an interview? Would you like me to help you if you've applied for a job and you've been denied? Would you like me to sit beside you when you call and ask why you couldn't get the job, why they didn't choose you? So there are many things that we can do to help each other. What we don't want to do is to sit in our little group and say, yes, I know what you mean. And all the majority people, they are really, really bad. Because that's not going to help us. That's just going to make us feel even worse.
Yeah, because those groups are many. Where you kind of join together in this
misery.
Yeah.
Yes.
And you kind of misery loves company.
Yes.
So it's kind of it doesn't help.
So so that's something we really have to help each other with, to be aware of. Are we helping each other here, or are we just spiraling
worsening
down?
The problem.
Worsening the problem. So what we want to do is we want to look for mentorship. We want to look for also just having the ability to go see people with various who are just different. Going to see a group and just seeing people. Someone who's a lawyer, someone who's a dentist, someone who takes care of our garbage, someone who's big, someone who's small, someone who's good looking, someone who's so looking, someone who's funny, someone who's smart, someone who's boring. Just getting a broad representation.
Yeah.
Not just constantly, because what we get from media is not always very nuanced.
Yeah.
And this is one of the big differences between belonging to a minority group in a society or a majority group. If we belong to the majority group, we get to see all these pictures of how we can be, what we can be. We have all these representations.
Yeah.
But when we belong to minority groups, especially if we belong to the Afro-Swedes,
it's
the
tough.
representation is really tiresome.
Yeah.
So we need to create our own different perspectives, different stories, different people, different voices, different art, different films.
Yes.
And we have to help our children find these. So that's where we start.
Yeah. So I have experienced this, what you're saying. I remember representation. I remember when I was actually studying to be a nurse.
Yes.
And this was up north.
Yeah.
Very isolated. Not many people of color there. There were so many experiences that I saw. For instance, I tried to go get makeup, a powder for my... But I don't know. I just expected, because it was I think it was a Swedish brand that had, because when you buy makeup in this country, if it is a Swedish brand, you go all the way to the darkest shade, and I usually can wear that with my winter shade. Yeah. So then I go up there and I asked this lady to get me that shade.
Yeah.
And of course, all the way up north, they don't have it. No. Of course, I didn't. I just asked her, why don't you carry? Because it's, that's what you use during summer.
Yeah.
And she said, well, in this market, they don't expect many to have the shade because it's all the way up north. But of course, if you go down south to Stockholm, so I'm like, never leaving the city. That was one experience. And the second one was that we were standing in line at a club. And me and my friend were going to nursing school, and this guy asked us, "So what do you study?" And I said nursing, and he said, "Of course, all Black people of color go to nursing." And I kind of like, okay, but it never affected me personally because I felt this was my passion. This is what I wanted to do. Yeah. And then fast forward, I'm working, and now all of a sudden it's like representation. People are so happy to see me
Yeah.
at a healthcare center,
Yeah.
and it's not as common as you would think that
No.
it is, because for some reason we're underrepresented
Yes.
in the healthcare field. So there's so many ways that you don't have to internalize being a minority, because at some point there's positivity to it that you can.
Well, and I think that also says a lot about you and your ability, that you have been able to remain true to yourself, and that your reaction when you encountered this makeup situation, it's very interesting that you said to yourself, "Oh, this is weird. They should have it." Whereas when I grew up, and I also grew up in like very, very white. I'm adopted from Ethiopia,
Yeah.
so I grew up with white parents in the 70s, 80s,
Mm.
and so when I went for makeup and there was none for me,
Yeah.
what I would tell myself was, "Oh, I'm too brown." So that's, I mean, whereas you said, "Oh, they're too bad,"
Yeah.
and that's the correct way, of course. That tells me that you already had a sense of identity, of black being something natural,
Beautiful.
beautiful even. Whereas I did not have that, and that made me much more vulnerable for the minority stress.
All right.
So that's how it works, and the same goes. So you experience someone saying, all black people become nurses, and you're like, that's a weird thing to say, which it is. Whereas I would have probably thought, when I was your age, oh, I did something wrong again, because I had no other references.
Yeah.
But of course, today, both you and I are experiencing people saying, "Oh, I'm so happy.
Yeah.
I'm so glad you're here. I'm so glad you're doing this
Yeah.
job, etc."
To be able
Which
to,
is
to
wonderful.
represent us.
Yes.
Yeah.
And hopefully we can encourage other young black people
Yeah.
to start working within
Yes.
whatever
Educate
they're
themselves.
passionate
Yes.
about.
So what we're talking about is basically an identity crisis.
Yes.
Would you describe it as that?
Sure. Identity crisis, and yes, an identity crisis that is a consequence of the societal lack of representation, I would say. So this is, I always try to talk about, like when we're talking about minority stress and the situation of belonging to different cultures, etc. The problem is not the people who are experiencing stress or anxiety due to this. The problem is the people who are not able to handle diversity within the society.
Yeah.
That people are rather narrow-minded and are totally surprised. "Oh my God, you didn't sound that black when I talked to you on the phone." It's like,
I've heard
oh my
that.
goodness. Yeah,
I've heard that
it's
before.
such a weird thing to say, but that's very much not your problem, but that person's
Their
problem.
Yeah.
Yeah.
And that is very important to realize, that
Yes.
it's a you problem and not a me problem.
Exactly.
And then distance yourself from that.
And yes, and then again comes the community, being able to go see someone and say, "Do you know what this person said?"
Yeah.
And we can laugh at it instead of going home thinking, "Oh, I don't sound black enough."
Yeah.
And it's also, I mean, that's also black enough. That's also an interesting thing. How much are we helping each other within our own community? How badly is the colorism splitting us from each other? Are we seeing each other as part of the same community, even though we have very different skin tones, hair textures, facial features?
Yeah.
Or do we separate and think that some people are not black enough? Am I black enough even though I've been adopted? Or do I have to have come as an immigrant? Or is someone who's come as an immigrant, is that person close enough to Swedishness and whiteness? Or do we see that person as someone else? So this is, I think, also a challenge for us.
Yeah,
and I think
because at times the enemy is within.
Exactly.
Yeah.
And I think sometimes we need to actually find the groups that have very much exactly the same experience as ourselves, like having come from this specific country when we were children or when we were grown up. And sometimes we need to share the experience of just being Afro-Swedes,
Yeah.
which is really, of course, a really diverse identity.
And different from everyone.
Yes.
Yeah. So just going back to yourself and being you,
Yes.
your individual self, not trying to be somebody else.
Exactly.
Being accepted.
Exactly. Yeah, very much that. That is
Yeah.
very much what it is about. And sorting out what is what. What is me struggling with myself? What is me struggling with society?
Yeah.
Yeah.
Well, this the concrete strategies, because I've been reading a little bit,
Yeah.
and you have concrete strategies
Yeah.
to deal with
Yeah.
minority stress.
Yeah, so I would say like what I've said many times already, but I cannot stress it enough. And that is also what research shows,
Yeah.
is that having access to community.
Yeah.
And for me, for instance, that is both having access to an Afro-Swedish community and an Ethio-Eritrean community, and a community of people who have been adopted from Ethiopia and Eritrea. So
Yeah.
like really many different levels. But it is also having close friends who have similar experiences as I, so that when I am in a stressful situation, I can just text them. We have this little group, and I can text them and say, I am in this really, really weird situation, and I can just get a little heart from them. And I remember, yes, all right, I'm not alone. And it just grounds me back.
Yeah.
And my stress levels just are totally reduced. So that's one thing, having community. The other thing is, since this is like an extra level and an extra layer of stress, negative stress, and we know negative stress takes a toll on our health.
Yeah.
We have to be extra mindful about our health.
Yes.
And so I usually talk about five kinds of health: somatic, physic health, psychological health, mental health, social health, which is the community part, existential spiritual health, and creative health. So somatic is really easy, like eating, sleeping, all that. Psychological, like having a balance in your life, enough stimulation, enough rest, being mindful. Social, of course, being together with people who make you feel good, basically. Existential, spiritual, like for someone it may be to be able to pray or to go to a religious group. For some it may be to walk in nature. And then creative health, both being able to like listen to music, see arts, but also creating yourself, like painting, dancing, singing, baking, working with your car, but just
Culture.
crafting, culture, yes.
Yeah.
So all these things, and of course we're talking about stress, and we already have minority stress, and we're already stressed out. Now I just mentioned 5 different things that we have to think about. So it's not that. So it's just like being mindful that all these parts are the things that can help us heal and stay strong and be sustainable. And I can choose to do one thing on Monday and one thing. So I can, like, I'll take a sleep in 15 extra minutes on Monday. Tuesday, I'll do something for my mental health. I will meditate. Wednesday, I'll call that friend that I know I really like to talk to. Thursday, maybe I'll try a prayer today. Friday, I listen to my favorite song. But I just make sure that I do this mindfully, that I'm aware that now I'm giving myself a little bit of space, finding my breath back.
Yeah. And the thing is with community, with social health, it's also important to have the right group of people around you, because you might have friends that are not good for you, that maybe want to do things that are not healthy for your somatic health and your psychological health. So then you have to, I think most of these things we do naturally or just like take it for granted.
Yes.
So going back, we have to be mindful of what we're doing.
Exactly.
So if you do have a situation where you don't feel good about yourself, then you have to strategically think about these steps.
Yes, I think that's really, that's a really valid point. And also, like asking ourselves, am I exposing myself to destructive behaviors?
Yeah.
Why am I doing this? How is this helping me? And do I have other arenas where there are more sound behaviors?
Yeah, I can
And
express
how can
myself
and how can I move myself towards those?
that. Yeah.
So many times it's really much more helpful to look for and search for the things that make us feel good rather than telling ourselves, I shouldn't do this, I shouldn't do that. So if I tell you, please don't see a blue elephant standing in the desert. Just don't see it. Don't see the please don't see the blue elephant standing in the desert. Stop looking.
I'll see the blue elephant.
Yes, you see the blue elephant. And it's the same, like if I keep telling myself, don't smoke or don't eat, don't overeat, what am I gonna wanna do? Or what is gonna happen? And that's the only thing, because our brain is really lousy with thinking about in negations. So that's why what we want to do is to ask ourselves, what would I like? What do I want to say? Okay, I want to see myself having a happy family.
Yeah.
Okay, so that's the image I want to create in my brain. How would I like to go about to get that happy family?
Manifesting.
Yeah, very much. Yeah.
Yeah.
It's like positive affirmations, but I mean, when we say positive affirmations, many of us like see that little note on the mirror where it says smile, and we feel like I come up and I'm depressed and I'm having all these things to worry about, and then there's this stupid sign saying smile. It just makes me angry, of course. So I'm not saying we should not validate. I think it's important to validate. I think it's important to be true to ourselves and our feelings. But when we want to change things, it's important to focus on what would I like? What would be the good way for things to be?
Yeah.
Positive thinking is also kind of tricky, because if we're feeling very low, it's very difficult to think anything positive. So I think one of the things, when we're feeling low, when we're feeling anxious, one of the things that we often forget is that we all have many different feelings, whether we feel them or not.
Yeah.
And being able to access all those feelings and being aware that they are very often contradictory. Very often we can feel really happy, we can like someone, we can admire someone, and at the same time, that very same person maybe has hurt us.
Yeah.
And maybe we're angry with that person, and then we're having very mixed feelings towards this person.
Yeah.
But if I can allow myself to feel my feelings, that's not the same as acting on them. But if I can allow myself to feel all my different emotions, then I can also connect this with my intellect and my cognitions, so that I use both sense and sensibility.
Okay.
And from there, I can really make my choices. It's much easier to know, where do I want to go? What do I want to do? So that's when we decide on how to act. Not just, I am feeling one feeling and now I'm acting, because that's when we do that, many times that's when we find ourselves having acted out, not thinking clearly.
Yeah.
And if we are in touch with our feelings, we can also use our cognitions, rather than just getting stuck and just trying to think, which will happen if we're not in touch with our feelings. Then we just have to figure everything out mind-wise.
Yeah. And then get that stress.
Yeah, and we probably won't know what we want, because we are not in touch with our own feelings. So how can I know what I want if I don't know what I feel?
Yeah. We're overthinking a lot.
Then then we're just overthinking.
Yeah.
So some of us have a tendency to overthink. Some of us have a tendency to overreact.
Yeah. Always looking for an enemy or something.
For instance, or just very reactive. Like we don't need very much and then we explode.
Yeah.
And regulating this is something that we sometimes need to practice. Sometimes, especially if we're carrying trauma, we might need first to and this is something that we can usually get help with from our health central,
Yeah.
getting some help with anxiety regulation,
Mm.
just like learning how to breathe, how to soothe ourselves when we are in stress and anxiety. Perhaps we need help sleeping enough, getting good habits, getting into good routines. So there is a lot of like, and this is fairly easy to acquire.
How about acceptance?
The issue of acceptance is very interesting, and I really believe there is a lot to win in accepting that things are the way they are. That doesn't mean I have to like them.
Yeah.
So, for instance, accepting that, okay, I live in a society where there are people who believe it would have been better if I would never have come here. And at the same time, I really enjoy being a Swede. And that is sad.
Yeah.
And some people will never see me as a human being. Some people will never think that I belong here. And that is sad. And I have to accept that that is the way it is.
Yes.
I don't have to like it. I can decide to work. I can work politically. I can work as trying to be a role model. I can work by supporting others who are doing things, who are writing articles, who are studying, researching, whatever. There are so many ways in which I can try to change things. But I can still accept that things are the way they are.
Yeah. My last question is, why do you or why don't you have a book? Why are you not published?
Well,
are you published?
No.
Have I missed that?
No.
Because I Googled it.
No.
I looked for your book because I want to
Thank
read
you.
something. Why are you not published?
I've been studying forever. I have had children. I just haven't been able to make my time.
But you're thinking about it. Oh, you thought about it.
I've thought about it. I would love to, but it's
in progress.
It's not in progress. It's not in progress. But I just don't know how and when I will find the time. But I hope I will sometime. I'd love to write a book, and I think I would probably hate to write a book because it's such a huge project. So we'll see.
Let's hope that you will get published, because this information needs to be in print.
I have to ask you, so what would that book be about?
Well, everything that we've talked about and more. Everything we've talked about and more, because you have so much to share to the world, and I would like to have that in print.
Oh, well, thank you.
I would really love that, just to get into your head.
Well, I will keep that in mind. Maybe we'll write a book together. Who knows?
Oh, I would love that.
See?
What a privilege. All right, Hanna, thank you so much for blessing me with this interview. And I hope to see you back here.
I'd love that.
And waiting for that book.
Well, thank you. Thank you so much for having me.
You're welcome. Thank you, everyone, for watching. Make sure that you tune in next time, and hopefully we can have Hanna back. Please let us know your thoughts of this interview. If you have anything to say, anything to add, put your questions and your experiences with minority stress, with therapy, with everything that we've talked about. Put it in the description box, and we can make something
that would be super interesting.
Thank you so much for watching. Do not forget to subscribe, like, and comment on this interview. I'll see you next time. Bye.